Hey guys, welcome back to our introductory course. I just wanted to add this little brief introduction into imaging techniques. Like I mentioned in lecture, you guys are going to be talking a lot more about it as you get into radiology and whatnot, but you certainly want to understand some of these techniques and what you're looking at in some of the radiographs and how these different images are obtained and when it is you need to decide to use which imaging technique depending on what it is you're looking at and depending on some of the risk and benefit situations. So, of course, one of the most conventional, easiest things that we can do is conventional radiography. That's what we would think of when you think about an x ray, right? So, if you're getting an x ray of some type of tissue, this is really great for hard, dense, bony material. And so, you can kind of see this poor individual has had a little bit of an accident there, and but we can see the nice, hard, bony structures, dense materials. As you can imagine, it's not going to be as useful for soft tissues, so you can't really see what's going on with the brain and whatnot inside there. So just bony landmarks, pretty much. You can see down here that we can use contrast dyes to improve visibility. So as you get a section or a radiograph of the colon there, the large intestine, you can definitely use that to get some contrast dye, perhaps in a fluid like a barium swallow, that would help improve that type of technique. And then there's a special type of X-ray procedure, which we call the DEXA scan. A DEXA scan is a modified X-ray, where we call it a dual energy X-ray absorptiometry. Basically, this is used to measure bone density. And we looked at a radiograph earlier where we saw osteoporosis in the vertebral column. This is a very useful scan. And what you're actually measuring is the density of the bone in different parts of the body here. As you can see on this top one, we have a normal individual who's within the normal bone mass density. And then down here, we would have somebody with osteopenia. Osteopenia is a condition that could progress to osteoporosis. And you can see we're kind of in the yellow now, kind of heading towards that way. So it's definitely, you would have to think about bone density and how to take care of the bones in that situation. Of course, I mentioned earlier that we have our ultrasound tools in the Holly's office, so definitely take advantage of that. Check them out if you'd ever want to get some practice in them. And the beautiful thing about ultrasound is that it's used to measure moving structures underneath the soft tissue. And it's going to use these echoes of high frequency sound waves. So you add some gel in there, and I think maybe later on when we do our caudal approach to the epidural, there's a procedure that shows you how to use the ultrasound to locate the sacral hiatus and to guide the ultrasound needle, not the ultrasound needle, but the epidural needle to its location. So this is great for obstetrics due to its safety. We don't have to worry about any type of radiology or radioactivity. And you can also use this for some soft areas next to the surface. Here we can see the common carotid artery, for example. And as I mentioned earlier, when we talk about carotid stenosis, you can kind of see where the external carotid artery and the internal carotid artery are separating. And here you can actually observe some plaque, some stenosis. And then, as we mentioned in cardiovascular class, you can measure the flow, the velocity of that blood going through there to see the degree of stenosis. And that's a very useful technique for imaging. Here we have our magnetic resonance imaging, and of course here we're going to use a huge magnet, hence the term magnetic resonance, and we can use this magnetic fields in order to get a nice image of the softer tissue inside. And so very beautiful image of the brain, for example, and we can also observe the spinal cord in here, and just nice way to keep it to get the soft tissue. Of course, with metal implants, maybe if you have a certain type of pacemaker or a hip replacement, a knee replacement, those might be factors that we might consider when obtaining an MRI. So when we're thinking about a disc herniation, we talked a lot about disc herniations, and MRI is going to be pretty much the go-to diagnostic scan that you would use to get an idea or to get an image of that disc herniation. I think I showed this to you in our lecture, but here you can see without the contrast, and then here you can add contrast for the MRI, and that can help pick up any type of abnormality like a herniated disc, for example. Of course, you can modify the MRI. You have what we call a functional MRI. Functional MRI is going to give you a real-time activity of what's going on in the blood flow. So you can measure different areas where you have a higher amount of blood or lower amount of blood. Do notice it is not radioactive, so that is good. Unlike the X-ray, which is a radioactive, we don't have to worry about that. And you don't have to worry about injecting tracer dyes or anything like that. This can pick it up. And here we can see some active areas in the brain that are being monitored and picked up by that functional MRI, or just fMRI for short. Of course, a CT scan, you guys will be taking quite a few of these, a computerized tomography, what we like to think of as the CAT scan, CT scan, CAT scan, either way is fine, but we don't actually spell it with CAT, we just spell it CT. And what we see here is that the X-ray beams are confined to a slice, a thin slice of the body. So you can take several cross sections, and here we can see a cross section through the abdomen, for example. And one thing you will notice about a CT scan, this is actually taken typically from an inferior view. So these are usually inferior views. And this is important when you're trying to understand the anatomy, you're trying to understand the organ orientation, because you're used to looking at models or at cadavers or at other patients, and you're trying to see, okay, well, how do I get this liver on this side of the body? And remember, the liver's on the right side, and you're thinking, well, there's the stomach right there, and there's the gallbladder. It's like, what the heck? How do you get that view? You would get that view if you were looking upwards at an individual from underneath, right? So if this section was taken through the abdominal wall, like here, you would have to look upwards to get this orientation. So if you can't quite figure out whether you're looking at something superiorly or posteriorly or anteriorly or inferiorly, any of those directions, if it looks really weird, something like this, chances are it's taken from an inferior view. So keep in mind that it's going to be looking up through the patient's feet, and you'll see a lot of CT scans like that. Not quite conventional what you would see compared to what you would see in the anatomy textbooks. Another type of imaging technique we can see here is positron emission tomography, or PET scan. So positron using radioisotopes, so it does have some radioactivity involved. But because of its usefulness, it definitely, if you're thinking about a patient that might have cancer, obviously the benefits would outweigh the risk factors in this case. Or if you have a brain or a heart condition, definitely something to keep in mind with these PET scans. Of course, endoscopy is a very common procedure because it's very easy to just anesthetize somebody, for example, and give them a duodenal scan, right? So, or an upper GI scan, something like that. So here you can see a nice use of a camera. Then once again, there's no radiation or anything involved. You just simply use the camera, and not very invasive, is very minimal, and it can be used to take a biopsy of tissue if you're looking maybe for polyps, for example. With a colonoscopy or something like that, any type of endoscopy, you're going to be using some scope in order to visualize what's going on in there. Easy peasy. So a couple things to keep in mind as you are moving forward and looking at radiation in healthcare, because you as PAs will be dealing with a lot of imaging techniques. You do want to keep yourself safe and healthy and try to reduce the amount of radio exposure. So some of these guys will be beneficial in that they don't use any radiation. So, for example, when you use ultrasound, easy peasy, no worries, right? You can use ultrasound all day, all night. The sound frequencies, they don't hurt a thing. MRI, once again, we don't have to worry about anything radioactive, or do we need to with endoscopy. Like I mentioned with radioactive substances, you do have risks involved, and of course, there are slight risks. So for the patient, it's not usually a big deal because they don't have these scans all the time. But as a practicing PA, it might be something to keep in mind. You'll obviously want to make sure you're well protected, which is why if you ever get an x-ray in your mouth, for example, for the dentist, usually the technician will have that nice they will step out of the room typically, right? Yeah. So things that do use radiation, of course, X-rays are one. The PET scan, the PET scan, and CAT scans. All of these are types of X-rays, and so is the DEXA scan, right? I didn't mention that, but DEXA, or actually it should be capital E, DEXA, is also be using that. All right, guys, this was just the end of our first lecture, so I will go ahead and end it here. You all have a good afternoon, and I will see you in our lecture on Friday. See you then.